This video is going to show you how to do intraoral soft tissue examination. It is divided into 6 parts. Part 1. Lips, labial mucosa and labial vestibule. Begin the examination by inspecting the lips, including the commissure areas and the vermilion borders. For inspection of the lower labial mucosa and vestibule, slide both index fingers downwards and use your thumbs to invert and retract the lower lip. For inspection of the upper labial mucosa and vestibule, slide both index fingers upwards and use your thumbs to invert and retract the upper lip. For palpation of lower lip, compress the tissue between your index fingers and thumbs. Repeat the procedure for the upper lip. Part 2. Buccal mucosa and buccal vestibule. For inspection of the right buccal mucosa, place your index fingers on the inside and stretch the tissue up and away from the teeth. For inspection of lower buccal vestibule, slide your finger down towards the mandible and stretch the tissue down and away from the mandible. Repeat the procedure for upper buccal vestibule. For palpation of the right buccal mucosa, place your index finger of your right hand intraorally while compressing the soft tissue against the middle finger and ring fingers of the left hand, which are placed outside of cheek. Palpate the entire length of the buccal mucosa. Repeat the whole inspection and palpation on the right side. Part 3. Tongue. First, inspect the ventral surface of the tongue by asking the patient to place the tip of the tongue to the roof of the mouth. Next, inspect the dorsal surface and the tip of the tongue. Ask the patient to relax the tongue and protrude it slightly. Use a mouth mirror to reveal the posterior portion of the tongue. After that, inspect the lateral border of the tongue. A damp gauze piece is used to hold the slippery tongue. It is folded over the tip of the tongue. Gently pull the tongue to the left commissure. Repeat this procedure for the left border of the tongue. For palpation, the body of the tongue is gently pressed between the index finger and tongue. Part 4. Floor of the mouth. Begin inspection of the anterior region of the floor of the mouth by asking the patient to touch the tip of the tongue to the roof of the mouth. Next, inspect the posterior region of the floor of the mouth by asking the patient to protrude the tongue and use a gauze piece to grasp the tip of the tongue and pull the tongue gently towards the corner of the mouth. For palpation, place your right index finger on the floor of the mouth on the right side. Position the middle and ring fingers of the left hand under the patient's cheek. Palpate the floor of the mouth by pressing upwards with your extraoral fingers and downwards with your intraoral fingers as if you're trying to make your fingers meet. Palpate from the right posterior region to the left posterior region. Part 5. Salivary gland function. Begin the examination with the submandibular gland. Ask the patient to raise his tongue towards the roof of the mouth. Use a gauze piece to gently dry the area around the sublingual caruncle and sublingual fold. Press down gently with the cotton tip applicator in the region of the caruncle. A drop or stream of saliva should be evident if the gland is functioning properly. Next, evaluate the functioning of the right parotid gland. Locate the parotid papilla on the buccal mucosa opposite to the maxillary second molar. Use a gauze piece to dry the papilla. Using the tip of the cotton tip applicator, roll it from the area slightly above the parotid papilla down to the papilla while applying gentle pressure. Repeat the rolling action several times as necessary. A drop of saliva should be seen. Repeat the procedure on the left side. Part 6. Palate, tonsils, and oropharynx. First, start by visually inspecting the hard and soft palate. Next, palpate the hard and soft palate. Avoid sliding your finger across the palate, as this may cause the patient to gag. Instead, palpate an area and lift your index finger away from the palate to reposition it. Finally, inspect the tonsils and oropharynx. You will need a mouth mirror to move the tongue out of the line of vision. Position the mouth mirror with the reflecting surface down. Ask the patient to say "ah" as you depress the back of the tongue.